And now I give the floor to Ms. Inez Feria for her presentation.
Thank you very much. Good afternoon, everyone. So we are here now to discuss the human rights situation in the Philippines in the context of the UN Joint Program, and where it is actually potentially a very good opportunity for us to make positive changes. Under this joint program, there is also a clear risk, actually, of institutionalizing human rights violations under a UN Joint Program for Human Rights. I struggled with this because how can we move forward and fix things if we are not honest of what has been happening and continue to be happening, and we quibble over numbers instead of acknowledging the wrongs that have been committed against Filipinos and where we should be facilitating accountability. I struggle, how can claims be made to address human rights violations when many times there is no clear understanding of where the violations are coming from? And this is especially true when we speak of treatment and health, where actions and programs remain punitive and repressive. There also continues to be a culture of surveillance and control. We have a very bad habit of tagging and labeling people. In the drug response, people continue to be placed on lists, and where it becomes so easy to scapegoat and arrest and kill in the name of the drug response, where we lay blame where there should be none. We've arrested people on the lists and heard reports where evidence is planted. It has also become easy to fabricate drug charges against individuals that have been considered as enemies and letting them languish in jail. The message seems to be, if it's drugs, we'll fix you or else. And this is the same kind of thinking that has fueled tens of thousands of people getting killed. Quibbling over numbers will not make this reality less real. The joint program is a space, a unique space where government and civil society are able to work together. But we have to be seriously committed to create the changes that the joint program was intended for. And it should not be simply a laundry list, a ticking off exercise, and make sure that the programs really do translate to positive changes on the ground. So when we say we do training, for example, capacity building, what are we capacitating people for? How would we assess being capacitated? How do we assess that these programs and training programs actually translate to engagements on the ground that protect and safeguard human rights? These are the questions that we need to be asking, instead of asking whether somebody attended the program or not, or just quibbling over like ticking off number of attendees in programs, ticking off number of graduates in community-based programs, instead of really trying to ask the questions that we need to be asking. Are these programs improving quality of life of individuals? And in doing programs under the joint program, are we sure we are not placing people in greater harm? How many have, in good faith, attended so-called community-based programs only to miss the last half because then it was found out they had been killed? If we talk about health response, why are we not urgently setting in place harm reduction services that can protect and save lives? We have the evidence. Why are we ignoring that? How come until now we have no ethical standards set in place, whereas one government official said harm reduction is good, but sorry, we have a drug-free mandate. The joint program does not exist in a vacuum. We have to recognize that there are laws. This has been mentioned, where the laws that has caused overcrowding in our prisons, sections of the law which are disproportionate, where you have someone who was arrested for selling less than 1 gram of methamphetamine is dealt a life sentence much, much harsher than homicide? Why are there laws and regulations, policy issuance and bills where information gathering is the norm? We have to stop the list. We have to continue monitoring the joint program. The work is not done. We have opened an opportunity where potential is great. If we drop the ball now and cease to continue to be critical and thorough in monitoring, we will have missed an opportunity for other nations to learn from as well. And we would miss the opportunity to put in place safeguards and protections for the next generation. Now is the time to put things in place. I will take seriously what has been said about working with civil society organizations. Civil society organizations are the ones working on the ground. We are here to help to create the kind of environment, the kind of environment that truly protects human rights. And one last thing, to make real changes happen also, there are prerequisites. None of any of our recommendations would bring about meaningful change if it still lives within the narrative of living in a drug-free Philippines. This narrative is getting us stuck. If we continue with this narrative, we will continue to violate human rights. So I ask you, as we continue discussions, the joint program is an opportunity. There are words in the joint program, let them not be empty words. We can work together, but there has to be serious commitment among all those who are involved. Thank you. Honesty, commitment, sincerity. We need to acknowledge the wrongs done and continue to be done. For again, I say, how can we claim to be fixing something that we do not acknowledge as wrong in the first place? We need to see and feel the sincerity from the government to take responsibility for the harms caused, and to acknowledge the impact on the victims, families, and communities, and to not only communicate but show concretely the commitment to change into reparative actions. To everyone here and listening, to all listening, please continue to scrutinize the activities and implementation of the joint program and to demand accountability. You have invested in the joint program. Help protect the space that has been created by the joint program for civil society to work closely with government. Civil society is critical and integral to the success of the joint program. But for full good implementation, we need to feel safe to speak, to criticize, to recommend, assured that government welcomes this and takes this seriously as we would do when they speak. This is to ensure that our goals for genuine human rights protection is indeed a unified one. Please continue monitoring. Ask the critical questions. This means asking, is there truly meaningful participation of communities affected, the communities of people whose lives include drugs? Is there serious effort in ensuring safety of everyone involved? For how will we know positive impact of the joint program if we do not ask and make it safe for communities to speak? Listen to those who are impacted the most. They are primary. We need to revisit and review also the joint program indicators. With the current indicators, we have set the bar too low for human rights, showing, for instance, ridiculously low 1% reductions of those in pretrial detention, where we have overcongested our jails and prisons at an average of 400%, and as high as almost 3,000% overcongested. That's 30 people living in a 2 by 2 meter space. Serious efforts to decongest our jails and prisons begins with recognizing and acknowledging the role of our drug laws and policies that need to be revised. And these are the ones that are driving the arrests and arbitrary detention and over-incarceration. To take the UNJP seriously, the joint program seriously, where implementation needs to embody its essence of righting the wrongs and setting things in place to protect our next generations. It is also the least we can do for those who have died and whose lives continue to be at risk. To institutionalize human rights or to institutionalize human rights violations, this is now our collective choice as to which direction the joint program will take.